Welcome to the pre-operative hip replacement class at UF Health Central Florida's Joint Center. Hello, and welcome to UF Health Central Florida's pre-operative joint replacement education class. My name is Kayla. I'm the orthopedic navigator and registered nurse here at UF Health Central Florida. Now that you and your surgeon have determined that surgery is the best treatment option for your condition or injury, you may be feeling overwhelmed with questions. This class is designed to help guide you through each step of the surgical process. Our goal is to provide you with the information you need to feel confident, prepared, and supported every step of the way. Thank you for choosing UF Health Central Florida. During this class, we will help you prepare for your upcoming hip surgery and set you up for a smooth recovery. Here's what we'll be covering today. We'll start by introducing your care team, the people who will support and guide you through this entire process. Next, we'll look at the anatomy of the hip so you can better understand what's being addressed during surgery. Then we will talk about how to prepare for surgery, including setting up your home and understanding your nutritional needs. Finally, we'll review what to expect after surgery, including therapy, discharge planning, and when to reach out for help. Preparation is key to a successful surgery and recovery, so we encourage you to follow along in your surgical guidebook and take notes as needed. Go ahead and grab a pencil and paper so you can jot down any questions or points you may want to remember. All right, let's get started with our first topic. You'll have an entire team of experts working to support you through your joint replacement journey. This includes your surgeon, nurses, orthopedic navigator, therapists, and other specialists, all focused on helping you prepare for surgery, recover safely, and return to the activities you love. Each member of your team plays an important role, bringing their own expertise to make sure you receive comprehensive, personalized care every step of the way. Remember, you're never alone in this process. We're here to guide you, support you, and help make your recovery as smooth as possible. Before we talk about hip replacement surgery, it helps to understand how a healthy hip works and what kinds of changes can lead to pain or limited movement. The hip is one of the body's largest joints. It helps us stay balanced and supports our weight whenever we walk, stand, or move. The hip works like a ball and socket joint. The top part of the thigh bone, called the femur, forms the ball, and the acetabulum, part of the pelvis, forms the socket. The surfaces of both the ball and socket are covered with smooth cartilage, which allows the joints to move easily and without pain. When that cartilage becomes damaged or worn down, it can lead to stiffness, pain, and difficulty performing everyday activities. Even simple tasks like walking and putting on socks and shoes can become challenging. Damage to the cartilage can occur for several reasons, including arthritis, injury, or certain childhood conditions that affect joint development. As the cartilage continues to break down, the once smooth surfaces become rough and uneven, causing painful, limited movement. Eventually, the bones can begin to rub directly against each other, known as bone-on-bone contact. This results in chronic pain, swelling, stiffness, and for many people, difficulty walking or moving comfortably. A total hip replacement replaces the worn out or damaged joint surfaces with artificial parts called a prosthesis. These parts are made from strong, durable materials like metal, plastic, or ceramic. The goal of surgery is to reduce pain, restore movement, and help you return to daily activities with greater comfort and independence. So what actually happens during surgery? During surgery, your orthopedic surgeon makes an incision to access the hip joint. There are several surgical approaches that can be used for total hip replacement surgery, and there are risks and benefits to each approach. Several factors can influence what surgical approach is best for you, and your surgeon will help make that decision. Once the hip joint is exposed, the femoral head is replaced and the acetabulum or socket in the pelvis is resurfaced. Once the new components are in place, the incision is closed using staples or medical adhesive and covered with a sterile dressing to protect the area as healing begins. If you have not already done so, you will need to enlist a coach prior to surgery. This is a trusted person of your choice who can support you both before and after surgery. They do not need any medical background, just a willingness to learn, be present, and help you with your recovery process. Your doctor will order the necessary labs and pre-admission testing before surgery. In some cases, you may also need clearance from a specialist, such as a cardiologist. All required testing and clearances must be completed prior to your pre-op visit with your surgeon. Your doctor will also review your current medications. Some medications will need to be stopped before surgery, and you will receive instructions on which ones to hold and when. On the morning of surgery, you may take approved medications only with a small sip of water. It is very important to stop taking medications and supplements that increase bleeding risks. This includes ibuprofen, naproxen, Celebrex, Mobic, and aspirin. Supplements such as vitamin E, fish oil, and certain herbal products should also be avoided. Your doctor will provide clear instructions on how and when to stop these safely. You should also start thinking ahead about your living situation for after surgery. Consider how you will move safely around your home, whether you need help with stairs, and how to manage your space to avoid unnecessary bending, reaching, or tripping hazards. Planning ahead will make your recovery much smoother. Lastly, if you smoke, now is the time to stop. Smoking can slow healing, increase your risk of infection, and make your recovery more difficult. Quitting before surgery greatly improves your overall outcomes. If you need help, let your care team know so we can connect you with resources. Your coach plays a huge part in helping you recover successfully after surgery. By offering encouragement, support, and hands-on help, your coach can make a real difference in your healing and confidence. As a coach, you'll learn lots of important things, like what blend thinner medication your loved one is taking and how often it should be taken, how to care for the surgical dressing, such as keeping the incision clean, dry, and protected, what signs of infection to watch for, such as redness, swelling, drainage, or fever, and when to call the care team. You will also learn about safe mobility, which is how to help your loved one walk, move, and use equipment correctly without putting them at risk. You may also be asked to help with TED hose. These are compression stockings that help prevent blood clots. Remember, your support helps your loved one heal faster and feel more confident. Before your surgery, there are a few important things that will need to be completed. These steps help your team make sure you're healthy and ready for your procedure. You'll need to have lab work done within 3 months of surgery and an EKG within 6 months. You will also review all medications you are currently taking with your physician, including herbal supplements, to know which medications will need to be stopped prior to surgery. If you have an advance directive, like a healthcare surrogate or living will, please bring a copy with you to your pre-op visit and again on the day of surgery so it can be added to your medical record. Now, let's talk about nutrition, before and after surgery. Your body needs to be well nourished to heal bones, muscles, and skin that are affected by surgery. The nutrients from food provides us with strength, energy, and the ability to heal. People who are well nourished overall are less likely to develop infection and heal faster.
Nutrition for joint replacement, before, during, and after surgery. The importance of nutrition. Good nutrition is important before surgery. Your goal should be to eat healthy and avoid any unnecessary weight loss prior to your surgery. Some patients are asked to lose weight prior to their procedure. At this time, it's recommended that you maintain your weight and have sufficient nutrition stores prior to the surgery. This ensures that you'll have strength after surgery for rehabilitation and physical therapy. Some important nutrients we'll talk about are protein, calcium, vitamin D, fiber, water, vitamin C, and zinc. Protein, focusing on high-quality protein foods that contain all the essential amino acids, aid in wound healing, and keep your immune system strong. If you've had an orthopedic surgery, it's normal for your appetite to be depressed, so eat a small amount of protein at each snack and meal. Protein is not just for muscle building, it's a key nutrient in bone building. So if you have a fracture, make sure to include protein with every meal and every snack. Calcium and vitamin D are nutrients associated with healthy bones. The best sources of these nutrients are low-fat dairy foods. All milk is fortified with vitamin D to help absorb calcium. Yogurt also is a good source of calcium. It's not always fortified with vitamin D, so check the nutrition label on your favorite yogurt to make sure you're getting enough vitamin D. Aim for 2 to 3 servings of milk or a calcium-fortified food per day. Your serving size looks like 1 cup of milk, yogurt, or soy milk, 1.5 ounces of natural cheese, or 2 ounces of a processed cheese. Make sure to consume fiber-rich foods prior to and after surgery to avoid constipation, unless your doctor tells you otherwise. Fiber-rich foods include whole grains, bran, fruits, vegetables, beans, and lentils. It's important to increase your fiber intake slowly in order to avoid gas and bloating. Adequate fluid intake is also very important if you're increasing your fiber intake to avoid adverse effects. Prunes or prune juice, along with drinking plenty of water, have a natural laxative effect that can alleviate constipation while taking these pain medications. Drink at least 8 glasses of water or other calorie-free beverages per day to help with the prevention of constipation. Adequate hydration will also help to promote healing. Vitamin C is needed to make a protein called collagen and is needed for repairing tendons, ligaments, and healing surgical wounds. Citrus fruits are high in vitamin C. However, don't overlook other sources of vitamin C, like strawberries, kiwi, fruit, baked potatoes, broccoli, and bell peppers. Zinc is also important for wound healing. Zinc is a mineral found mostly in animal foods, meat, fish, poultry, and dairy foods, but is also present in whole grain breads and cereals, dried beans, peas, and nuts. It's better to get zinc from foods than supplements, especially because high-dose zinc supplements can cause nausea and vomiting. Healthy nutrition is important after surgery as well. Your doctor will determine the appropriate diet for you after discharge based on your medical history. More information on healthy nutrition can be found at www.choosemyplate.gov. If you have questions about your diet during your stay at the hospital, dial 35223 from your hospital phone. If you would like to speak to a dietitian prior to admission, please contact one of our registered dietitians at 352-323-5223.
Remember these key nutrients needed before, during, and after surgery: protein, calcium, vitamin D, iron, fiber, vitamin C, zinc, and water. Aim for 2 to 3 servings from each of these food groups. Meat alternatives: 1 serving equals 2 to 3 ounces of meat, poultry, or fish, half a cup beans, half a cup tofu, or 2 tablespoons of peanut butter. Milk alternatives: 1 serving equals 1 cup of milk or soy beverage, or 1 cup of yogurt. The evening before surgery, you'll be NPO after midnight. That means no food, no drinks, and nothing by mouth after midnight. This also includes gum, mints, and candy. However, your surgeon's office will give you 2 special drinks as part of a process called carbohydrate loading, which helps your body prepare for surgery and recover more smoothly. A meal replacement drink, such as Ensure, provides protein and nutrients to help your body get ready for healing. You will drink this the evening before surgery, prior to midnight. You will also be given a carbohydrate drink, such as Gatorade. You will drink this the morning of surgery, before you arrive at the hospital. If you live nearby, you may want to start this at home so it's finished before you check in. This drink helps keep your blood sugar and energy levels stable during surgery. Together, these drinks help your body handle surgery better, recover faster, and support healing. After surgery, your diet will be advanced slowly based on how well you tolerate food and drink. The speed of advancement may be different for each person. To help you know what to expect, here are some common diets your surgeon may prescribe for you. A clear liquid diet consists of clear liquids like water, broth, juice, or plain gelatin. These are easy for your body to digest right after surgery. A full liquid diet includes all clear liquids with the addition of milk and small amounts of fiber. Your diet advancement to solid foods will be determined by your doctor and is based on your past medical history and other pertinent factors. Before surgery, take time to make your home as safe and easy to move around in as possible. Even small changes can reduce your risk of falls and injuries after surgery. Clear pathways by moving electrical cords, phone chargers, and clutter away from hallways and walking areas. Choose supportive seating. Avoid low or soft chairs or sofas. Use chairs with armrests to help you sit and stand safely. Remove throw rugs. These are one of the most common causes of tripping after surgery. Navigating stairs after hip replacement surgery can be challenging, but taking a few simple steps ahead of time can make things much easier and safer. Install sturdy handrails on both sides of stairways. Ensure stairs and hallways are brightly lit, and add nightlights if needed. Keeping stairs clear of clutter, cords, and loose items can also help to avoid tripping and falling after surgery. Before surgery, take some time to set up your bedroom so it will be safe and easy to move around in during your recovery. Make sure there's a clear path between your bed and the bathroom. You don't want to trip on anything when getting up at night. Keep a lamp and phone close by so you don't have to reach or get up suddenly. After surgery, always sit down while getting dressed. It's safer and helps prevent falls. And if your room is dark at night, consider adding a nightlight to help you see your way safely. The bathroom can be one of the most challenging areas after surgery, so let's go over a few simple ways to make it safer. Consider installing grab bars or handrails in the bathroom and shower to give you extra support and stability when standing or sitting. Place non-slip mats or strips in the tub or shower to help prevent falls. Even if you feel steady now, remember, your leg may be weaker for a little while after surgery. Your therapist may also recommend a 3-in-1 commode, which can be used as a raised toilet seat or placed at bedside if needed for added convenience and safety. A few small changes like these can make a big difference in your comfort and confidence while you recover at home. Now, let's talk about the kitchen. A few small changes here can really help make things easier once you're home. Store frequently used items at waist level and place less frequently used items in higher or lower cabinets. Bending, reaching, and climbing can increase your risk for falls, so it's best to keep things easy to reach. Even small step stools should be avoided. It may be helpful to prepare and freeze some meals prior to your surgery. That way, you'll have easy, ready-to-heat options when you get home. Okay, let's go over what to bring with you to the hospital and what to leave at home. Please bring rubber-soled, non-skid shoes or closed-back slippers for safety when walking. Don't forget your personal items, such as dentures, hearing aids, and glasses. You may also want to bring a case for these items as well. Please bring loose, comfortable clothing for therapy. Shorts or sweatpants are recommended. Pack a complete list of your current medications, including doses and times you take them. If you already have a walker bring it with you to the hospital so therapy can ensure the height is adjusted correctly for safe use. If you don't already have a walker, let your surgeon's office know ahead of time so one can be ordered for you before surgery. Be sure to bring all your insurance cards and a valid photo ID. Please do not bring any valuables to the hospital. This includes jewelry, cash, or any personal items that can't be easily replaced. It is best to leave these items safely at home to avoid loss or damage during your hospital stay. Before surgery, you'll be asked to drink a meal replacement shake like Ensure and a carbohydrate drink such as Gatorade. This process is called carbohydrate loading. It helps prepare your body for surgery. These drinks will be provided by your surgeon's office during your pre-op visit, along with specific instructions on when to take them. Drink the meal replacement shake the evening before surgery prior to midnight. Then, drink the carbohydrate drink the morning of surgery prior to arriving at the hospital. The meal replacement drink gives your body protein and nutrients to prepare for healing, while the carbohydrate drink helps maintain stable blood sugar and energy levels. Together, these drinks help your body handle surgery better, support healing, and promote a smoother recovery. In this video, we will be reviewing how to properly bathe using chlorhexidine gluconate, also known as CHG or HIPAA. This is a special soap used before surgery to help reduce the number of germs on your skin and reduce your risk for surgical site infections. You will be given specific instructions by your surgeon's office on when to begin bathing using CHG. Some supplies you will need are a small bottle of CHG soap. This you should get at your pre-op visit at your surgeon's office. You may also purchase this at many local pharmacies without a prescription. You will also need clean washcloths and a towel, clean pajamas or clothes for after your shower, and freshly washed bed linens. If you are going to wash your hair, face, or private areas, please do so using regular shampoo and soap prior to using CHG. Be sure to rinse thoroughly. CHG should not be used on your hair, face, private areas, or any open wounds. To apply CHG, turn off the water or move away from the stream to avoid rinsing off the soap too early. Gently apply CHG to your entire body from your neck down using small circular motions. Be sure to pay special attention to the area of your body where surgery will be performed. Do not scrub too hard. Gentle circular motions will be enough. And remember, do not use CHG on your hair, eyes, ears, nose, mouth, private areas, or any open wounds. Wash your body thoroughly for 2 to 5 minutes. Turn the water back on or step back under the water to remove all the soap. Afterwards, pat yourself dry with a clean towel, dress in clean pajamas or clothing, and remember to sleep on freshly washed bed linens. If you experience a rash, burning, or skin irritation, please stop using CHG and contact your surgeon's office. Just a few additional reminders. Please do not shave the area of your body where surgery will be performed. If you are allergic to CHG, you may use an antibacterial soap such as Dial instead. And as always, please follow any specific instructions given to you by your surgeon's office. Bathing with CHG is a simple but important step to reduce your risk of infections. If you have any questions, please reach out to your surgeon's office or your orthopedic navigator. Thank you for taking this important step and preparing for a safe and successful surgery. Take a moment to pause this video and test your knowledge on a few things we've already covered. When you're ready, you can unpause the video to see if you've answered each question correctly. Now, let's take some time to go over some of our most frequently asked questions. Starting with, will you need a blood transfusion? Although most patients do not require a blood transfusion, It is possible. How long will you stay in the hospital? Most patients are able to go home the same day as surgery once they are medically and surgically cleared. Your orthopedic surgical team and physical therapist will work with you to make sure you're ready before discharge. You will be cleared to go home once your vital signs are stable, your physical therapy goals have been met, and your pain is well controlled. Please make sure your coach or support person is available to provide transportation on your day of discharge. Our team will make sure you're safe, comfortable, and ready to continue your recovery at home. When can you get out of bed? Our goal is to have you up and walking the day of your surgery. Evidence shows that early ambulation can improve your recovery, reduce complications, and get you back to your normal activities sooner. Your care team and physical therapist will be right there to help you get out of bed safely and take those first steps. Can you drive after surgery? No. You will need to arrange for someone to bring you to the hospital and pick you up when you are discharged. Your surgeon will let you know when it is safe to drive. For most patients, this is usually between 4 and 8 weeks after surgery. Everyone heals at a different pace, so it's important to follow your surgeon's specific recommendations. What equipment will you need at home? You will need a 2-wheeled rolling walker, and you may also need a bedside commode. The bedside commode can be used to increase the height of your toilet or as a seat in the shower if needed. Where do you go when you are discharged from the hospital? Most patients return home with home health services a few days a week. The surgeon, therapist, nurse, orthopedic navigator, and case manager will assist you to determine the best discharge plan for you. So what if you live alone? A safe and supported home environment is key to a smooth recovery. You may return home after surgery once you can safely get in and out of bed and walk a short distance using a rolling walker. To help ensure your success, it's important to have a friend or family member available to assist you during those first few days of recovery. Will surgery be painful? Pain management after total joint replacement has improved significantly over the years. Thanks to advances like regional nerve blocks, spinal anesthesia, and other modern techniques, most patients experience much better pain control than in the past. In addition, early movement and rehabilitation are key parts of your recovery and help reduce stiffness and discomfort. While it's unlikely to be completely pain-free, we're committed to helping you manage your pain effectively. Together, we'll set a realistic pain goal and ensure you take your prescribed medications as directed to keep you as comfortable as possible. What are advance directives? It is a means of communicating your wishes regarding your health care. A living will provides written instructions explaining your healthcare wishes if you are unable to communicate. A medical power of attorney or healthcare surrogate is a designated individual that can make medical decisions if you are unable to do so for yourself. Will you need therapy when you get home? When you return home, you may receive home health physical therapy, begin outpatient physical therapy, or continue the exercises provided by your hospital therapist independently at home. Your care team will work closely with you to determine which option is best for you. Each of these options is designed to help you safely regain strength, mobility, and confidence. Every patient heals at their own pace, and your therapy plan will be tailored to meet your individual needs and progress. Let's talk a little about what to expect the day of surgery. A pre-admission nurse will call you the afternoon or evening prior to your surgery to inform you of what time you will need to check in. This is usually done after 3 p.m. When you arrive, head to the designated check-in area. A clerk will check your information and give you an identification armband. You will wear this throughout your entire stay. You will be asked several times to confirm your name, date of birth, and the procedure you are having. This is an important step to ensure your safety and is standard protocol. After check-in, you will be escorted to the pre-operative area or to a surgical waiting room. You'll spend about 2 hours in the pre-op area getting ready for surgery. Your family will be able to stay with you during this time until you are taken back to the operating room. To protect the privacy of all patients, we kindly ask that no more than 2 visitors stay with you at a time. The surgery itself usually takes about 1 to 2 hours, depending on your procedure. After surgery, you will go to the recovery room. Your surgeon will update your family, either in person or by phone, on how everything went and how you are doing. Although time in the recovery room can vary, most people remain in the recovery room for about 1 to 2 hours following surgery. The waiting room may be chilly, so please let your family know they may want to bring a sweater or jacket for their comfort while waiting. Now let's go over what to expect for pain control, both during and after your procedure. The morning of surgery, you'll meet with your anesthesia provider to review your plan and discuss the best option for you. Most patients receive spinal anesthesia, which keeps you comfortable and relaxed without being fully asleep. Some may receive general anesthesia, depending on individual needs. After surgery, your care team will use several methods to keep your pain under control so you can move safely and recover comfortably. Pain relief may include scheduled pain medications to stay ahead of discomfort, a nerve block to help numb the surgical area, oral or IV pain medicine as needed, and ice packs to help reduce pain and swelling. If you have your own cold therapy machine, we recommend leaving it at home. You'll be provided with reusable ice packs during your hospital stay that you can take home. Our goal is to help you stay comfortable enough to move, which is an important part of your recovery. Pain after joint replacement surgery is normal. Our goal is to help you manage it effectively so you can move safely and recover well. Before surgery, we'll work with you to set a personal pain goal. This goal should be realistic, not 0, but a level that's comfortable enough for you to get out of bed, walk with therapy, and participate in your recovery. During your hospital stay, your nurses will regularly ask you to rate your pain on a scale from 0 to 10, 0 being no pain and 10 being the worst pain imaginable. This helps your team assess and adjust your pain management plan to keep you as comfortable and mobile as possible. While you're in the hospital, your care team will focus on keeping you safe, preventing complications, and helping you begin moving again. Following surgery, you will need to take blood thinners for several weeks to help prevent blood clots. Your surgeon will discuss this with you prior to your surgery. TEDHOs, which are anti-embolism stockings, and SCDs, which are compression devices, may be used to help prevent blood flow and reduce your risk of developing a blood clot after surgery. TEDHOs should be worn until your surgeon tells you it is safe to discontinue them. We will also encourage you to do ankle pumps to help improve circulation. Antibiotics are given before and sometimes after surgery to prevent infection. Use your incentive spirometer 10 times every hour while you're awake. And remember to cough and take deep breaths regularly. This keeps your lungs clear and helps prevent pneumonia. Your care team will remind you of these steps throughout your stay to ensure you recover safely and comfortably. Physical and occupational therapy are key parts of your recovery after surgery. Your therapist will work with you starting the day of your surgery to help you get moving safely and regain independence. Your physical therapist will focus on helping you get out of bed and walk safely using a walker, teaching you how to climb stairs and move safely around your home, and guiding you through exercises to improve strength, motion, and balance. Your occupational therapist will help with everyday activities like getting dressed, bathing, and using the bathroom safely. They will teach you how to use adaptive equipment as needed and show you energy-saving and safety techniques to make daily tasks easier. Both therapists will make sure you're comfortable, confident, and ready to go home safely. After hip replacement surgery, your new joint will need time to heal and adjust. To help protect your new joint and reduce the risk of hip dislocation, you will work closely with your physical therapist to learn specific precautions. Your exact precautions may vary depending on your surgeon and the type of surgical approach used, either posterior or anterior. Here are some general guidelines to help keep your new hip safe. Do not cross your legs at the knee or the ankle. Avoid turning your toes inward. Do not step backward with your surgical leg. If you are told you have posterior precautions, you will also need to remember no bending at the waist past 90 degrees, and avoid twisting on your operative leg. For an anterior approach, you'll focus on avoiding excessive hip extension. In other words, don't stretch your leg too far behind you, and avoid turning your surgical leg outward. Your therapy team will guide you through these movements and help you practice safe ways to sit, stand, and move as you heal. They will ensure that you know the proper precautions for your surgery before discharge. Physical therapy is an essential part of your recovery after hip replacement surgery. Your therapist will work with you to help you learn how to move safely and confidently using your walker, on flat surfaces, and on stairs if needed. You'll also learn important skills for home, such as how to get in and out of a car, bed, and chairs, and how to perform specific exercises to improve strength and range of motion in your new hip. It's important that you use a walker at all times when walking until your therapist or surgeon says it's safe for you to transition to a cane or to walk independently. Now let's watch a few short videos put together by your therapy team that demonstrates these exercises and skills.
All right, we're gonna go up the stairs now. When we use the stairs, we use the rails, and we're gonna put our strong leg up onto the first step, and then we'll lean forward, follow with our surgical leg. Progress up with our hands, we'll go up with our strong leg, follow with our surgical. Strong leg, follow with the surgical. The helper should follow behind them for safety in case they lose their balance. We'll turn around. So going down the stairs, now we actually use the rails. We'll progress down with our surgical leg first, and then follow with your stronger leg. So then your stronger supportive leg is holding you up on the steps safely. Excellent. All right, we're gonna get inside the car. So open the door for them. Walk over, using the walker for support. We're gonna square up with the seat. We're not gonna step in the car like you used to. Okay, we're gonna then put forward our surgical leg, and that helps us with our hip precautions, following the rules. We're gonna reach back to the car seat, reach back to the dash, and then we'll slowly sit down. Okay, so we'll move the walker, and then we're gonna slide our hips back into the seat toward the console. We'll bring in our left leg, and then our surgical leg, we'll just bend it enough to get it in the car. Okay? Yeah, always think of your safety and having the leg out straight for comfortability. To get out of the car, same thing. We'll bend the surgical leg. We'll slowly come around using our hands on the car seat and the dash. Move the walker, again, having the right leg, surgical leg out for following our hip precautions. We'll push from the car seat and the dash when we come up. We're gonna go up a threshold, as in going inside your home. We're gonna have the walker support. We step a little bit closer. We'll put the walker up onto the step, and then we're gonna promote going up with our strong leg, and then follow with our surgical leg, leaning on the walker, good support. Now leaving the house, going outside, we're gonna do the same, come close to the edge. we'll pick up our walker, back leg land first, and then we'll go down with our surgical leg first, followed with our stronger leg. Go ahead and get into bed. So again, using your walker around the house, but think about when we come into the bed, we're gonna come up here higher in the bed. You might have to step sideways. Think about where your pillow is when you lie down or sit down, and then you lie down toward the pillow. Think of that space, because otherwise once you're in, you have to move up high in the bed. So her surgical leg left, I'm gonna have her put it out, and then I'm gonna have her reach back with her hands, and she's gonna lower down to the bed. Thinking about our hip precautions, that's why we have the leg out. Also, with a hip replacement, we also want to have that left leg on the outside of the bed, the surgical leg, and that makes it just easier, less distance for it to have to move. So we're gonna have you scoot back onto the bed deeper, and then as we go up, we're gonna have her bring up her right leg. I like dig that heel in there, and then we might help up her left. And you see how her right leg was able to help move her body around, and then the assistant might help the left leg. Go ahead and get out of bed, okay? So to get out of bed, I would like her to bend that right leg some. We're gonna come up on those elbows, push up partially. We're gonna bring out the surgical leg, and it slides down the side of the bed. Very good. We're gonna come over and we're gonna sit in our chair. So using the support of our walker, we're gonna step over and square up with the seat. We should feel the chair against the back of our legs. We're gonna have our surgical leg a little bit forward, and then we're gonna reach back with our hands and slowly go back. Okay, we're gonna get out of a chair. So first we like to scoot our bottom forward. So not too far, just about a fist distance off the front of the chair. We're gonna push with our hands, of course, as we always need support. We're gonna have our posterior hip precautions. You would have your left leg, surgical leg forward, and then you're gonna lean forward and stand up. If you have an anterior hip precaution, you could have your foot flat on the floor. It would be just fine. Ankle pumps. Ankle pumps are exercises for our gastroc, our calf muscle, and also good for blood flow. We're gonna pull our toes toward us, hold for 5 seconds so we get a good contraction, and then we're gonna push away, same, 5 seconds so we get a good contraction. This exercise is quad sets. Our quadriceps are on the front of our thigh. We're gonna push our knees flat into the bed, tightening up those muscles, and hold for 5 seconds. Get a good contraction. You wanna see your knee move. This exercise is glute sets or gluteal. It's our backside butt muscles, and we're just gonna squeeze those muscles together, hold for 5 seconds, get a good contraction, and then relax. Exercise is heel slides. We're gonna bend one knee, and then we're gonna have our other leg, and we're gonna slide our heel up toward our bottom, bending as much as we can. Depending on your pain and your weakness and your ability, you might not be able to go very far. But at the top, we're gonna pull it up, hold for 5 seconds, and then we'll slide back down flat. I like to give a pause for 5 seconds also. This exercise is short arc quads. We can use a pillow and just roll it up, or we can use a towel roll under our knees. So what we're gonna do is just straighten that leg. You're getting the end range of our knee movement, tightening up our quadricep really tight. Hold for 5 seconds, and then slowly lower down. This exercise is long arc quads. It's the movement of the knee in more of a full range We're going to sit at the side of the bed or in a chair. We're going to focus on kicking the leg up straight, pulling the toe toward you with a good strong contraction on that quadricep. Kick it up. We're going to hold it 5 seconds and then slowly lower down, promoting as full of a range of motion as you can.
Following a knee or hip replacement, occupational therapy's primary goal is your safety and independence with your self-care. A part of that will be introducing you to adaptive equipment and techniques so you're able to reach to the floor level, your feet level, for your dressing and your bathing while maintaining any precautions that your surgery has. Your therapist may introduce a long-handled reacher that you can use to don your pants by bunching up the pants or getting the waistband of the pants, fishing your foot through the leg and pulling that up to the knee level, or you can use your other hand to hold onto it. You'll start with your surgical leg, just because it does not have the range of motion that the non-surgical leg has. In your kit may also be a sock aid. You will load the sock onto the end. Drop it to the floor, hanging on to the handles, slipping your foot in and then pulling both at the same time as your foot slides through the tube into the sock. Most kits will also come with a long-handled shoehorn. It just sits in the back of your shoe. Your foot slides in, slides through the shoehorn, and out.
Your surgeon may have recommended a home health agency for in-home care following surgery. Home health services provide support in your home, assisting with daily activities such as navigating around your house and incision care if needed. In addition, physical and occupational therapists may continue your rehabilitation to ensure a safe recovery in the comfort of your own home. Many of these home care services, including short intermittent visits and necessary medical equipment or supplies, are covered by Medicare and most other insurance plans. If your surgeon has recommended outpatient therapy, you will continue your rehabilitation at a therapy clinic. These are structured sessions where a therapist will help you build strength, improve range of motion, and restore function so you can safely return to your normal activities. Your therapy plan will be customized to your recovery progress and individual goals. Once you are medically and surgically cleared, the next step in your recovery begins: going home. Before discharge, your care team will make sure you're safe, comfortable, and confident about what to do once you leave the hospital. You'll receive discharge instructions, including your medications, activity guidelines, and follow-up appointments. Many patients go home with home health services, where a nurse or therapist visits to help you with incision care, safety, and exercises. Others may continue their recovery with outpatient therapy, depending on your surgeon's plan and your progress. Your coach or support person plays a big part during this time, helping you with transportation, reminders, and encouragement as you regain your independence. Remember, recovery continues at home. Your team will be checking in to make sure everything is going smoothly. As you return home, remember, your recovery continues, but you're not alone. You now have the tools, knowledge, and support to help you heal safely and confidently. Keep following your therapy exercises, take your medications as prescribed, and use the safety tips we've discussed today to stay on track. Ask for help when you need it. That's what your coach, care team, and home health providers are there for. Every day, you'll notice small improvements. A little more movement, a little less pain, and a lot more independence. Our goal is for you to stay happy, healthy, and active at home so you can get back to doing all the things you love. Now let's talk about planning for discharge. Although most patients are able to go home the same day as surgery, some may be kept overnight for observation to ensure everything is stable before discharge. If you are going home the same day of surgery, your surgeon will have already set up everything you need prior to coming in for your surgery. If you stay overnight for observation, your case management team will work closely with you and your loved one to make sure you have everything you need for a safe transition home. This may include arranging any equipment you'll need, like a walker or raised toilet seat, or coordinating home health services if it's recommended by your surgeon. As previously discussed, the goal is for you to return home after surgery once you're medically ready, safe to move, and comfortable with your discharge plan. Although it is not expected, some people may require a short-term stay at a rehabilitation facility to help regain strength and mobility before returning home safely. Your care team, including your physical therapist, surgeon, and case manager, will work closely with you and your loved ones to help determine the best discharge plan to meet your individual needs and ensure a safe, comfortable transition home. When planning your ride home after surgery, it's important to choose a vehicle that's easy to get in and out of, especially since your movement will be more limited right after surgery. Cars that are low to the ground or lifted too high can be difficult and unsafe to enter and exit. Vehicles that are easily accessible, such as mid-size SUVs or sedans, are the best option for your discharge day. Try to avoid sports cars or large lifted trucks, which can make transfers challenging and uncomfortable after surgery. Your physical therapist can even practice car transfers with you before discharge to make sure you and your coach feel confident for the ride home. Take a moment to pause this video and test your knowledge on a few things we've already covered. When you're ready, you can unpause the video to see if you've answered each question correctly. Your care is important. Please feel free to contact your orthopedic navigator if you have any questions. Thank you for choosing UF Health Central Florida's Joint Replacement Center. Thank you for taking the time to attend the preoperative joint replacement class. We hope this information helps you feel more confident and prepared for your upcoming hip surgery. Before you leave, please scan the QR code on the screen and complete the short form to confirm your class completion. You'll be asked to enter your class code. For today, that code is 0716. If you have any questions after class, please don't hesitate to reach out to your orthopedic navigator or your surgeon's office. We're here to support you every step of the way, from surgery through recovery and beyond.